Hello, my name is Dave Wormuth. I'm a thoracic surgeon, and I work in the Roswell Park Care Network at St. Joseph's Hospital in Syracuse. Our patient actually was initially diagnosed with a lung cancer, and he was clinically a stage 3A. He had an outside bronchoscopy that showed a fungating lesion coming out of his left upper lobe. It clearly needed neoadjuvant chemotherapy and immunotherapy, which he received at one of our local hematology oncology groups with an excellent response. However, when we looked at his bronchus the second time around, I was very concerned because normally the bronchus is pink. Most of his was, but the takeoff of the left upper lobe was deeply erythematous. The mass had melted away, but I was very concerned that he's going to have a positive margin with just a conventional lobectomy. His lung function is such that he won't tolerate a pneumonectomy. We needed to consider a technique where we could take more of the main stem bronchus and then be able to plug the left lower lobe back into the left main stem bronchus, potentially having to adjust the bronchus and perhaps blood vessels as well. We didn't really feel as comfortable as we might be with doing a sleeve lobectomy, and that's what caused us to reach out to Dr. Dexter. When I subsequently talked to the patient about it, they were immediately on board. They understood that this was a relatively rare operation, and my personal philosophy is rare things should be done in places that do them all the time. Watching how surgery is done in other hospitals with other surgeons is very informative. And so I find it very interesting and rewarding to get that exposure to another facility and then bring the interesting parts back to Syracuse. One of the exciting things about working in the Roswell Park Care Network is that I know several of the surgeons that are here in Buffalo, including Dr. Dexter. I reached out to her to show her what we were seeing on the bronchoscopic pictures, and then asking her if she would be willing to let us do a sort of bronchial reconstruction if we need it and help us do that. And she was very helpful in facilitating that.
Hello, I'm Elisabeth Dexter. I'm one of the thoracic surgeons at Roswell Park Comprehensive Cancer Center. We actually did a bronchoscopy at the beginning of the procedure, and that showed that the airway in the upper lobe looked less involved than it had before he had his treatment. Because it was somewhat difficult to tell the difference between different anatomic structures using our scope, which we looked in with first, we decided to make the larger incision, the regular thoracotomy, and this allowed us not only to see with the scope, but now we could actually feel structures with our fingers and our hands and see a little bit more about the anatomy and the relationship of the structures to each other. We were able to just cut the airway off. We didn't have to take a cylinder of the left main airway. We just cut the base of the left upper lobe airway off, and then we sutured it closed and we covered it with an intercostal muscle flap so that we would have some viable, healthy living patient's own tissue to cover the stumps to allow it to heal better. The patient did quite well after the surgery. He stayed with us for about 3 or 4 days, and what was nice was that we were comfortable in knowing that he's going to return to his home in Syracuse, where we know Dr. Wormuth also practices and lives. He's going to be able to stay in his own community where his family lives, and where his support is, where his oncologist is, and get his care as usual after surgery. This is a newer situation because our care network is just expanding, but I will say that I have another patient of mine who's a long-term patient, at least 10 years out, who I operated on, who came back to me with a recurrent cancer, who lives in Syracuse. And I took care of that patient, did his surgery recently also, and he actually had a little bit of a issue with increased shortness of breath. We weren't sure what was going on, so instead of having him drive all the way back here to be evaluated, he actually saw Dr. Wormuth, and that he wouldn't have to drive out all the way in this acute situation where he wasn't feeling well. Dr. Wormuth saw him, he arranged for him to get a procedure which he needed. The patient felt better afterwards, and the patient was given the option of following up with Dr. Wormuth or coming out to see me again as usual, because I've been seeing him for years. And so he does have that option, which is nice. If you happen to have a patient in your community and you're not close to the downtown Buffalo area, please remember that we have 20 facilities across the state of New York. Please reach out to one of our facilities in your community and we can get them opinion and get them cared for. And if it's felt that they need an opinion from downtown, we can provide that.